everyone. Rowan Purtell here from the GP Academy. I'm a GP and a practice owner. I would like to talk to you tonight about the doctor's bag. I think the doctor's bag is a tool that's probably not as widely understood and utilized as it could be amongst our profession. I know doctors who have a doctor's bag for personal use, and obviously it's something that a lot of us would have in our practices as well. So a doctor's bag is simply a tool that allows you to conduct clinical visits in a non-clinical environment, really. So if you're at home or on the road and you come across a car accident or anywhere else really that you're not well stocked with medication, you can have a little bag ready to go that's got some bare minimum equipment and medications for you. This is what we think of traditionally, the leather satchel that you might see the old British doctor carrying around on one of the sitcoms that the UK likes to put out. But these days we've got much better technology, and doctor's bags can really consist of anything from a toolbox, a carry bag, and these expandable soft pouches that we can have these days. Personally, at our practice, we've repurposed an old fishing tackle box, which we've found works really well with its compartmentalized storage options. What should be in your doctor's bag? This is a good question. The RACGP has a minimum standard of equipment and items you should include as part of its 5th edition. If you're a practice owner and you're creating a practice doctor's bag, you will need to at least adhere to these minimum standards. If you're creating a bag for personal use that you're going to keep in your house or in your car, then you don't need to adhere to these, but I do find it gives you a good basic outline of what you should be including in your bag. Feel free to customize your equipment. Obviously, we all have different skills. If you're a GP that has airway skills and works rurally, you may want to include more airway equipment, for example, in your bag. I do know certain GPs that carry a bag around in the back of their car in case they come across road trauma accidents, and they really have a lot of equipment in there that would be very useful for that situation. However, if you're a GP who works primarily in pediatric medicine and is doing a lot of home visits, for example, where you're seeing children, you may not necessarily need that equipment, and you may need to customize it with equipment that you would find more useful. Similarly, I know a lot of palliative care GPs may do home visits. They may not need a lot of airway equipment. They may not need a lot of pediatric equipment. And so feel free to customize your bag with what you think you will need. I want to focus on particularly this 4th point that is outlined in the RACGP's 5th standards, and that is the medication side of things. What medications should we put in our bag? Where do we get them from? You may already be wondering about the cost associated with the practice or doctor's bag. One of the ways to reduce that cost is the PBS Prescribers Bag Supply Program. This is an initiative from the PBS that allows you to get medication for free for your doctor's bag. Not subsidized, not rebated, entirely free. Anyone with a valid prescriber number can apply for this program. So all our registrars, all our doctors. Essentially allows you to stock your bag with these appropriate medications that you can then supply or administer to patients as needed. The intent is that these medications are being used in emergency or urgent use scenarios. These are not medications you are prescribing, and we can't dispense medication as doctors, but we certainly can supply medication or administer it. So what medications might you consider stocking? Again, I want to hark back to that point I made earlier. Remember, this is for emergent use situations. So we're really looking at medications, things like atropine, adrenaline, salbutamol, obviously for asthma, pain medications. We've got panthrane, we've got opiates, medications for sepsis. As I say here, I've got medication listed for opiate withdrawal, oxytocin for antenatal or birthing emergencies, obviously. Most of the medications that you are administering and getting for your doctor's bag are going to be for parenteral route of administration. You may get some oral or sublingual medications like furosemide for APO. There is a full list of medications that you can stock and that you can order for free through the PBS Prescriber Bag Supply Program. And I've included a link here to that list. You may, again, want to look through it and choose what would suit your practice. How do you order the medications? You're going to need a prescriber's bag supply order book like I've got pictured here. You order this from Proda. If you don't use Proda, I would strongly encourage you to become familiar with it. Proda is more and more becoming part of our everyday practice. I use it regularly for my PBS authorities. You can use it to apply for provider numbers, obviously, these days, and for programs like this. So you click on the My Programs button, PBS stationary online ordering, and then you click and create a new order. You're ordering a prescriber bag order book. You can order one at a time, fill in your details and your address. They'll send you the order book to your registered address, and then you can fill it in with the medication you require. You fill it in as you would any script. As you can see here, this is the list of medications that I gave you. This is a sample of it. Write down the quantity you want. All forms are in triplicate, and you need to sign it, obviously. You keep the triplicate copy for yourself, and the original and the duplicate goes to the pharmacy supplying your medication. You can only place an order once per month, so make sure you order all the medications you require because you can't place another order that month. If you already have the maximum quantity of that medication available, then you can't order that maximum quantity again. However, if you don't have the maximum quantity available, you can order the maximum quantity again. So, for example, atropine, the maximum quantity you're allowed to order is 10. If you have 9 available, but you've used one or it's gone out of date, you don't have the maximum quantity available. You can order 10 again. Unlike a normal script, these are not valid for 12 months. They are only valid for 1 month. Once you've filled your order form in, make sure you submit it quickly. Where do you submit it to? Mostly your local pharmacy. They are all usually very happy to do this for us. But if you're not sure, maybe touch base with the local pharmacist first. As I say, you give them the original and the duplicate, and you retain the triplicate copy for yourself. Once they've supplied you with the medication, you do need to sign to say you've received the right quantity and the right drug. This is the legal requirement. If you get audited, they will want to see that you have signed to receive the right medication and you've acknowledged that you've received the right quantity. It is important to check off that the medication you're getting is exactly what you ordered. So make sure you keep that triplicate copy and check that against the medications supplied. This is, as I say, my personal practice's doctor's bag. As you can see, it's a repurposed fishing tackle box. We've got equipment like IV cannulas, airway devices in there, and we've also got oroscopes and stethoscopes. Where do you get this equipment from? Your usual suppliers, Warner Webster, Clifford Hallam, DocStock, T Medical, whoever you would normally use. What I would say is shop around. You'd be surprised at how much equipment costs can vary between the different suppliers. One might be supplying cannulas for very cheap, but not the IV giving sets. So you might order the cannula from company A, but the giving set from company B, for example. So yeah, do shop around when it comes to your equipment. Some practical tips that I have found useful over the years. Record keeping is probably the big one. These are S8 medications we're dealing with. They have overdose potential. They have a black market potential. They have an abuse potential. They have side effects, obviously. So they are highly regulated for good reasons. Make sure that you are, as I say, signing the medications in and keeping your receipt. Make sure you're doing counts with your nurses or other doctors regularly, and that 2 people are signing medications in and out after you've used the doctor's bag for a home visit or any other purpose, really. Safe and secure storage is really important. As per point 1, we're dealing with S8s here, making sure the doctor's bag is securely stored and locked as well. If it is a practice-owned doctor's bag, however, make sure the other doctors in the practice know where it is stored and also how to access it. Where is the key kept? So we've had that situation before in my own practice where, foolishly enough, we have a doctor's bag that's locked, but the doctor who needed it at the time wasn't aware where the key for the lock was and so couldn't use it. Make sure you tell your doctors where the key is. If it's not a keyed lock, make sure you tell them what the combination is, the code. Really important that they can access it. Expiry dates, medication and equipment does expire. For a personal bag, you could probably get away with only checking every 3 to 6 months, what your expiry dates are, depending on how heavily you're going to be using it, obviously. For a practice bag, generally you've got more doctors using it, things get used more. So you might want to get that checked more regularly. Your practice nurse could probably do that on a monthly basis. Again, depending on exactly how often you're using it. There has been a boom in ready-made doctor's bags online. You can Google doctor's bag, and sort of 100 links will pop up saying order my doctor's bag, and it comes with a bunch of medication and a bunch of equipment ready to go. They usually come at a premium cost, and if you're ordering this bag for your practice, make sure that it meets the RACGP 5th standards in terms of the equipment included in the bag. If you're not ordering it for your practice, they are often a good way to get started. It saves you having to order individual equipment items from different suppliers. And then as you go, you can customize your bag depending on what you're using it for. For example, if you take your bag out and you think I really could have used an LMA at that visit, and it wasn't included in your ready-made bag, you could decide to order one and add it on as you go. Or the complete opposite might be true. You might be doing lots of palliative care visits, maybe using some subcut lines, but you've never used the LMA or the ETT tube that was included in your bag. So you might want to throw those things out and replace it with more useful things. Again, feel free to customize, but remember, if it's for a practice, it must meet the minimum standards. Thank you very much. I hope that's been educational for you. I think the PBS Prescribers Supply program is a very useful program to enable us to stock medications in our doctor's bags for free, and I hope you all understand now how to access it. Thank you for listening, and if you do have any specific topics that you'd like me to cover in the future, please let me know by contacting the GP Academy. Enjoy your evening. Thank you very much.